The Norm Shear event is an annual education event that this year has been looked at by the Medical Education Committee, Dr. Boken, with the assistance of Dr. Wynn and Dr. Hewitt, to put a community and physician presentation together to educate us regarding care for the underserved. The whole Norm Shear event and the idea of bringing Victoria Sweet here to Visalia was actually initiated by Dr. Wynn. He introduced me to the book and said, you know, hey Ron, you got to read this book.
You'll hear a charismatic speaker who will say some practical things about what it's like to be taken care of very well when you need it. She has a perspective of looking back 1,000 years to the way people have been taken care of who in need of care.
A lot of the things in this book I believe in, number one, and it's a very patient-centered approach to medicine. The key to medicine is the understanding the patient, the heart of the patient, the suffering of the patient. I want people to understand there's a different way of looking at medicine than just simply the idea of what we can afford.
She's going to tell you about Dr. Diet, Dr. Quiet, and Dr. Merriman. And this is 1,000 years ago, but they were spirits in the idea of being well cared for then, so you should be somewhere that was reasonably quiet, comfortable, and pleasant to be, where the food was good. That's Dr. Diet. And Dr. Merriman, the people taking care of you were not supposed to be unhappy and grumbling about how awful it was, but the opposite, because they're treating you with hospitality. Hospital and hospitality come out of the same word, and so they're treating you as their guests. They are the hosts.
If we can do this right, there's ever been an event that can possibly impact our community any more than this.
We are going to expand from 11 rooms to 13. The 2 rooms will be primarily used for general surgery. We can do any type of case in there. Orthopedic, general, ENT. We actually have neurosurgeons coming into town, so the possibility of specializing one of these rooms just for neurosurgery is a good possibility. Both of these rooms will be pretty much the same. That way we'll allow to do more cases in each of the rooms. We're going to be putting in booms, video equipment, monitors. The latest technology available will be put in these rooms. By adding these 2 rooms, and I had mentioned earlier before, we can do several different types of surgery. We could do the neurosurgery, which takes 3 or 4 or 5 hours, or we can do hand surgery in there, and we can do up to 8 surgeries in any given day in one room. I would say if I was to be given a number for a total amount, probably 15-20 cases a day just by adding 2 rooms. Another one of the main reasons for the expansion of the 2 operating rooms is for physician satisfaction. Their businesses are getting busier. We've got new surgeons coming into town. We need this for recruitment as well. This also allows for each surgeon for doing cases in 2 different rooms. While they're doing one case in one room, the surgical staff is setting up the next case in another room, and that is a big satisfier for physicians. Another reason we're adding these 2 operating rooms is for patient satisfaction. Most patients want to get their cases done during the daytime, and this will allow that to happen.